Good morning. I'm Dr. Anil Guri, consultant in reproductive medicine, and I'm going to talk about two studies which are relevant to our day-to-day work. How many of us do hysteroscopies before IVF or before any fertility treatment? Often, we are told that if you have a hysteroscopy done, it may improve the chances of pregnancy, and it should be made the first test or one of the first tests before you go for IVF. And what these two papers answer is, should routine IVF, or rather routine hysteroscopy, be done before any IVF procedure? So when you look at the studies, there were two studies which were done. One was called the Trophy study, which was done from the UK with many centers, and the other was a study known as the Insight study. Now, the Trophy study was done, which was multicentric. It had 3 UK sites, 2 Belgium sites, 1 Italian site, and 1 Czech Republic site. 37 years and under, 8 oocytes were retrieved. No obvious intrauterine pathologies. Hysteroscopy was done before day 14. 591 women had an embryo transfer. It was named as a hysteroscopy in recurrent in vitro fertilization failure, a multicentric randomized controlled trial. Let's have a look at the results. Results showed that in the hysteroscopy group, the pregnancy rate was 42%. In the control group, where no hysteroscopy was done, the success rate was 44%. The clinical pregnancy rate was 38% in both the groups, and the live birth rate in the hysteroscopy group was 32%, and a control group was 33%. Now, if we put back a top quality embryo, the chances of having a live birth rate was exactly the same in the hysteroscopy and the control group. 35% in the hysteroscopy group and 36% in the control group. The second study was called the Insight study, again a multicentric randomized controlled trial of hysteroscopy before IVF. It was in women who were eligible for IVF, had a normal 2D vaginal ultrasound. Hysteroscopy was done 1 to 3 months before the start of the IVF procedure. 355 women were in the hysteroscopy arm, and 353 women were in the control arm. They had an 18-month follow-up. In that period, 14% of women had a natural conception. The others went ahead with IVF and ICSI. So when we have a look at the results, the hysteroscopy showed an implantation rate of 31%, and those who proceeded to immediately IVF without the hysteroscopy was 28%. The live birth rate was exactly the same, 21% in the hysteroscopy arm and 21% in the immediate arm. Ongoing pregnancy were exactly the same, and the total pregnancy loss in the hysteroscopy arm was 33%, in the immediate IVF arm was 23%. The biochemical pregnancy was 15% in the hysteroscopy arm, and immediate was 8.7%, again statistically not very significant. The miscarriage rates were again similar, 18% in the hysteroscopy arm, 15% in the immediate IVF. The live birth rate, as I said earlier, whether you did hysteroscopy before IVF or you did not do hysteroscopy before IVF, was exactly the same. In fact, after 18 months, it was noticed that 50% of women got pregnant in both the arms. So what do we learn from this study? That one, that hysteroscopy as a routine test has its limitations in improving the chances of pregnancy before IVF. What is important is it's important that you have a very good ultrasound which can check for abnormalities. And if you have a very good 2D ultrasound or you have a 3D ultrasound, the chances of having a normal hysteroscopy are much higher. Routinely asking someone to have a hysteroscopy when all the findings are normal does not give any additional benefit and does not improve the chances of pregnancy, as we know from different two studies. Thank you very much. Hello, I'm Dr. Anil Gudi. I am a consultant in reproductive medicine, surgery and assisted conception. As you all know, that Fertility Courses is a free online Facebook page which aims to give knowledge by discussing cases, by discussing reviewing articles, and by trying to spread as much knowledge as possible. I do see a lot of queries coming in, and I would request you that if you wish to get your queries answered, if you could drop an email on fertilitycourses@gmail.com with a detailed history. I'll be more than happy with my team to answer it on a Thursday when I'm in the hospital doing a review session of our cases. If you want any review cases discussed or articles discussed, I'll be more than happy to see it. I would be extremely grateful if you could rate this page and share it, because knowledge at the end should be shared with as many people as possible. This will improve the quality of medicine we provide to our patients. Thank you, and I hope you continue to enjoy the teaching on fertility courses.